Mizia, and I will be presenting meningitis. So what is meningitis and what are the different types? Meningitis is a medical condition that causes the inflammation of the meninges. The meninges is basically like a protective membrane that surrounds the brain and spinal cord. So if these membranes are inflamed, it can actually cause serious health issues. What are the different types? So the first one is bacterial meningitis. It's actually the most dangerous out of all of them, and it can be caused by a harmful bacteria which can enter the body through the nose, throat, and bloodstream. Um, it can spread through sneezes, coughs, sharing drinks, sharing utensils, stuff like that. If it's not treated quickly with antibiotics, it can actually cause permanent brain damage and even death. Viral meningitis is actually the most common and less severe out of all of them. It can cause by viruses like from herpes, mumps, measles. Most people who recover from viral meningitis actually don't suffer any serious problems. Some do stay in the hospital for hospital care, but just it can get spread to like a common cold or flu. So like by sneezing, coughing, touching contaminated surfaces, and stuff like that. Fungal, parasitic, and ambic meningitis are actually the most rare out of all of these. So fungal meningitis are usually like they threaten people with a weakened immune system. You can find them in like soil, bird droppings, or natural environments. You can smell the fungal spores from the fungi, and it can travel through your nose to the brain, and yeah. And it actually really develops really slowly, and you need antifungal medication for treatment. Parasitic is actually in the name. It's caused by parasites, and another name for it is actually esophilic meningitis. Ambic, there's actually another name for it. It's like PAM. It's just short for primary ambic meningoencephalitis. It's an amoeba found in warm water, so it's like in rivers, lakes. It can enter the body through the nose while swimming. So, and then it's almost really fatal. Non-infectious is actually not caused by bacteria or germs. It's actually caused by like hand injuries or like brain surgery or like autoimmune diseases like lupus. Chronic meningitis is when the condition lasts like for a month or more, and it just develops really slowly. So some symptoms, like stiff neck, high fever, headache, nausea and vomiting, sensitivity to the light, lack of energy, confusion, lack of appetite, and as you can see here, it can have like small round rash-like spots, but in some cases, so not most of them. Complications, seizures, brain damage, hearing or vision loss, learning problems, difficulty with movement and balance, memory problems, and behavioral emotional issues. So here are some treatment for the different types. So for bacterial meningitis, it's basically treated with strong antibiotics and sometimes corticosteroids to reduce swelling. Fungal can be treated with antifungal medication. Viral, it usually results on its own, but for like your like herpes and like influenza, it can be used with antiviral drugs. Non-infectious is by addressing the problem. Like I said, certain medication can cause non-infectious meningitis, so they would just like stop the treatment there. Another treatment can be IVs, fluids, pain relievers, rest, and moderate.
What is your slide on the diagnosis?
Like, I don't have that slide on.
You don't have it?
No.
What's with the transmission?
Transmission, it actually varies with the transmission in here. So like bacterial, it can like be caused by sharing drinks, utensils, coughing, sneezing. The viral one, it can actually spread like a common cold, like how you get like sick. Fungal, you can get it from soil, bird droppings, natural environment, stuff like that. Parasites, parasitic, obviously parasites. Ambic, water, like rivers, lakes. And then non-infectious is not caused by bacteria or germs, it's just by head injury, autoimmune disease, or surgery. So prevention, so obviously washing your hands, avoid close contact with people, covering your mouth and nose when you sneeze, disinfecting services, not sharing drinks, forks, or spoons, or anything like that, avoiding contaminated water, getting enough sleep, and then using protection against mosquito and tick bites, which can carry the viruses and diseases. And then
What is your frequency?